Okay, hello everyone. I am attorney Chinwe Foster with the Foster Law Firm. We are continuing with our COVID-19 and how it infects the law series. Today, I am absolutely honored to have Dr. Barbara Joy Jones, who was a family medicine physician with Northside Hospital. Dr. Jones is an expert, a medical expert who has appeared on various national and local news outlets such as CNN, HLN, NBC, and on other shows such as Sister Circle. Dr. Jones can be found on Instagram at with the handle at the model doc. And Dr. Jones is currently on the front lines fighting this COVID-19 pandemic. So we really appreciate you, Dr. Jones, being here with us.
Thank you. I'm glad to be here. Thank you for inviting me.
Of course, of course. And I'm just going to jump right in. I know that you're on the front lines. And a lot of people don't understand. Everyone knows that COVID-19 coronavirus is a virus, but can you explain what exactly is COVID-19?
Okay, so coronavirus is actually a family of viruses that have been along for a long. They've been around for a long time. Couple that we know of are MERS and SARS. So this is actually the second SARS virus. So it is a brand new coronavirus that we've never seen before. And so the reason why that's important is because we really don't know how it's going to act. Because it is new, 100% of people are at risk and can get it, right? And so, and then another thing is that we don't know if it's seasonal or not. You know how flu is usually November to about April and then it tapers off. We're unsure of if this is a seasonal thing where it will taper off in the spring with the warmer weather, or if it's going to continue on. So the reason why it's so important is there's a breakdown in people. If 100% of people can get it, 80% people with strong immune systems, our younger demographic, they're going to get mild or no symptoms, and they can be the ones that spread it asymptomatically. Or we have the 20% demographic that they are at risk for serious symptoms where they would get hospitalized. And within that demographic, there's a certain percentage, about 5%, that may need a ventilator. And if you look at that there are 300 million people in America, and 5% of that, we do not have enough ventilators to cover for that amount of people if we all get sick at the very same time. So what we're trying to do is everybody's at risk. 100% of the people can get it. So we're trying to delay that some people get it. The healthcare system can handle it. We have enough ventilators. There's 160,000 in America, which is really not that much to cover. And then it'll probably, as everybody gets it, then we'll have these little peaks and troughs of people that get it. But we're trying to, instead of have it be like this, and then a lot of people die because there's not enough ventilators to keep them alive, we're trying to make it little like this throughout a longer period of time. So that's the goal. That's the goal.
Yeah, those are some scary numbers. So 100% of people can actually get this virus?
Yes, because nobody has immunity, you know, because it's brand new. No one's ever seen it. So no one's ever been exposed to it to then form antibodies where if they were to encounter it again, they wouldn't get sick.
Okay, so how does it spread? How would someone get exposed to it?
So the primary way, there's three ways that it spreads. The primary way is respiratory droplets. So when I say droplets, those are the bigger droplets that you would that they come out of someone's mouth as they sneeze or as they cough, and then those respiratory droplets are in the air or get on you or on something that you touch, and then those droplets have to get in your eyes, your nose, or your mouth, your mucous membranes. So respiratory droplets, number one. The second way is something called aerosol. So that is not the big droplets, but airborne. So that's one of the scarier ones, is because if it's airborne, an example would be if you go to Marshall's or Ross and you smell perfume, you know that you're going in the direction of the perfume or cologne aisle. You don't even have to see it with your eyes. It's in the air and you smell it. So that's the same thing. Little particles that stay stuck in the air that if we walk past or we breathe it in, then we can get it in our lungs. Okay, so that's the second way, aerosol. The third way is fecal oral. So that would mean bathroom habits. Somebody uses number two. They may not wash their hands the way that they're supposed to. They touch you, touch your face, shake your hand, touch something, and then you come and touch that. And then same thing, mucous membranes. Then you touch your eyes, your nose, your mouth, and then you get the virus on the inside. So those are the three ways: respiratory droplets, aerosolized, and fecal oral. So fecal getting in the, in the mucous membranes. Yep.
Okay. And that's just kind of going back a little bit to what you said. You mentioned earlier that older individuals may be more susceptible to it. But what about, we've been seeing lately that younger people are getting this and dying from it. So who is more at risk?
I think that okay, so they are seeing that ages from 25 to 50, that demographic of patient, that they're young and they are not known to have diabetes or high blood pressure or those risks, that those people, the number one risk factor would be obesity. Okay, so and this is my theory on why that is. This is a respiratory disease, right? And it causes bilateral pneumonia. And basically, those people that have to go on a ventilator to basically give their heart and their lungs a rest, it's a lung issue. So let me see if I can show you. When you breathe in, your ribs will expand, and then your diaphragm is like a umbrella, and it balloons out and goes down. So if you are, basically the purpose is the ribs come out and the diaphragm goes down to allow volume for your lungs to expand, right?
Mhm.
If your lungs, if your abdomen is obese, it doesn't even allow the diaphragm to actually come down and allow that space and volume for your lungs to expand and take in more oxygen. So that puts you at a disadvantage. Does that make sense? That the obese abdomen pushes in, diaphragm can't come down, and you can't expand with as much volume as you need to. And you need that volume, and everything needs to be on your side if you're on that ventilator. So just the fact that the ventilator is trying to keep the alveoli open to keep oxygen and stuff in, you're put at a disadvantage if you can't open up the ribs and make the diaphragm go down to allow for more space for the lungs to expand. So that's what we're seeing if it's younger demographic, 25 to 50. Another one would be autoimmune disorders where people are on biologics, rheumatoid arthritis and lupus, or where people are on things that suppress their immune system, like the drugs Humira, right? So their immune system is decreased where they would not be able to fight as much. Asthma, right, in a younger demographic. And then also high blood pressure and diabetes. I'm primary care, and I'm seeing hypertension and diabetes a lot more in my younger demographics, 20s and 30s, where as if I had started practicing 20 years ago, those would have been diseases that didn't happen until like the 50s or 60s, but we're seeing it younger and younger due to lifestyle, being sedentary, the food type of foods that we eat, everything having preservatives, lots of vegetable oils and sugars that are basically, killing our bodies from the inside out. So young, it's obesity, and then as we get older, high blood pressure, diabetes. As we know, cancer patients that are on chemotherapy, they're immune suppressed, autoimmune disorder, and then yes, the elderly, because their immune system automatically decreases as we get older if we're thinking above 60 years old. And those are the risks.
Okay. Now, something a lot of my family law clients, parents are concerned about. One thing that we've been seeing a lot as family law attorneys is that parents don't want to allow their kids to go and visit the other parent. But from what you're saying, our children and I'm going to talk a little bit about the order that was signed by Governor Kemp, but are children at risk?
Um, I would say children, yes, they are at risk, not as much at all. I'm not sure of those children that did get the disease and those that have passed away. I've only heard of maybe one that was 17 in Lancaster in California. I think that we shouldn't necessarily be 100% concerned about children and them getting ill. It's the fact that that they can be a vector, that they can actually get it, and they may do okay, but then they come around that 20% demographic that I'm talking about that are immune suppressed, that they would have the severe symptoms or go visit grandma or grandpa, or maybe mom has breast cancer and she's on chemotherapy, or dad has rheumatoid arthritis and he's on some sort of biologic. It would be say they're not at risk. No. Are they less at risk? Sure. Do you want to take the risk? No. And most of the time they're the vector.
Okay, so parents who don't want their kids to maybe or go to school because schools are closed, or go visit the other parent because they don't know where the other parent has been, or who's around that other parent. Is that a valid concern given that children are not as much at risk?
Um, yeah, I would say that that is a valid concern, because the whole point of sheltering in is that you're able to control the environment that the child or that you are in, what comes in and out of your doors, what is clean, where someone has been, by staying indoors. And so if your child goes to another household, you don't necessarily know who's going in and out, if the way that they disinfect or clean their house is the same as you. So I would say that that would be a concern.
O-
Hmm.
Okay. And so now Governor Kemp passed this executive order that basically says that we Georgians have to shelter in place. Do you think that and it's only until April 13th, is that really going to help?
I do think it's going to help flatten the curve. I do. Um, but I personally do not think that this thing is going to hit peak for probably another 4 to 6 weeks. And so we're really just trying to flatten the curve. We're trying to find that medium of not being China, because they were shut down in draconian measures and they still have little peaks and stuff. We don't necessarily know right now because they kicked out all of our reporters, but I think that people have been indoors and haven't left the house in 15 weeks, and it has significantly helped decrease. But I think as they actually let loose more, um, that they have had a resurgence. Um, so I think it'll be in peaks and troughs, that like we hold it, let the healthcare system get whoever has been incubating, and then gets a full blown exacerbation and get really sick, take care of them. They'll probably open up things a little bit for the economy, to keep going, and then they have to, tighten back up. So I think it'll be in peaks and troughs until, I would say, until about 60 to 70% of the population gets it, because at that point, that 80% that have gotten it, that have strong immune systems, then will be immune. Unless the virus mutates. Does that make sense?
It does, but that's kind of scary. So why we okay? I guess first of all, how long do we have to stay at home for this to flatten? And two, if we have to wait for 80% to get it, is staying at home, how is that helping?
It's helping because we're not spreading it to that 20%. Like
Okay,
the
okay,
yeah, we want to keep the 20% that are already incubated and going to get it and need healthcare. We don't know. Every single day we're finding out, and they're going to the hospital.
okay. So how long do you think? I mean, I know with China they stayed at home, but now they're going back out, and so is something that could go on for a year.
Yeah, we could have peaks and troughs all the way until next year, until they get a vaccine. We really just don't know.
Okay. How far do you know how far away we are from finding a vaccine? How long could that take?
It usually takes 12 to 18 months. So I would say around this time next year, we may have one. It just depends, because it doesn't matter if we have a vaccine if it's not safe, right?
Mhm.
If you're going to give 100% of people a vaccine, and 30% of the time it causes something where there's some sort of reaction, what's the point? Because our job is to first do no harm. So at this point, 20% of people are at risk for severe symptoms. But if we give a vaccine where 30% of the people have a reaction, it doesn't match up. We don't want to do harm. So that's why if somebody's making a vaccine, they're going to do trials and make sure that it's safe. So that's why it takes so long. We could have a vaccine ready next month, but is it going to be effective, and is it going to help versus harm? We don't know, which is why they have to go through trials. And that's why it takes so long. Safety.
Okay. Now, when you start experiencing symptoms, how long should someone wait to go see a doctor, or go to the emergency room?
So usually the first symptoms we're seeing are people where they have the fever, cough. Some people start with this sore throat. They'll have diarrhea, maybe muscle aches and pains. The problem is the shortness of breath because remember, it's a respiratory pneumonia type situation. Um, when you have like severe distress where you literally can't breathe, where you are using accessory muscles and like taking shallow deep breaths and you can't get enough air, then it's time to call 911 or go to the ER. So my job as a family medicine physician outpatient is to basically, my patients are calling me. I get about, 5 or 6 patients that may call questions about COVID. Do I have this? What's going on? What's the threshold? And I give them anticipatory guidance. So my job is to keep as many of those 80% out of the hospital so that they are not like the worried well, that they're worried and they go into the ER and take up rooms or take up resources that I could have told the 80% to encourage them, because there's a lot of paranoid and anxious and scared people. Keep them home. And only that 20% that truly need it will go to the ER. So I basically say when you're having severe shortness of breath, that is when you call 911. That is when you have somebody take you to the ER.
Okay, and what about these masks? There are a lot of questions about should we wear masks? Should we not? What are your thoughts on that?
I would say at this juncture, yes. And the reason why that they were saying no before is because they didn't want lay people buying up all the masks if we made the recommendation and then they get masks and healthcare workers are without it, basically going into the line of duty without any protection. So these surgical masks and these cloth masks that you're seeing people make, um, those are not to protect you from getting COVID. Because remember, only that N95 fit mask that you're hearing about can protect from the aerosolized particles going in. Those are for healthcare providers. But if we're talking about these cloth masks and the ones that you're seeing out and about, or the surgical ones, those, the purpose of that is two things in my opinion. Number one, if you are a asymptomatic carrier, if you currently have COVID and you only have mild symptoms like a slight cough, or you are actually asymptomatic, the mask actually prevents you from coughing, sneezing, talking, respiratory droplets, or aerosolized particles into the air for somebody else to get it. And also, Georgia is number 1 in the country for allergies. So you get to fashionably put on a mask and prevent pollen and other allergens from getting into your system and causing an exacerbation of your allergies. Those would be the two reasons I would say that somebody should wear a mask. And now that there is a lot of production of those cloth masks and people are making them at home and selling them, I would say that I do recommend everybody wear a mask, because there aren't enough tests. We're not testing everybody. So you or I may be that asymptomatic carrier and you want to protect others.
Okay. Another question that I've had clients call in and ask, in addition to should I allow my child to go to this other person's home? I'm sorry, not the other parent's home, because I don't know what they're around. Another question is I have clients who they have loved ones who are incarcerated, who are in jail. Um, Being in close quarters like that in jail, do you think that people in jail could be more at risk because they're in close quarters? Um, I know that that's kind of a convoluted question, but that's a question that I've gotten a lot. My loved one is in jail. My loved one has been arrested. I don't want them to catch the corona. Is that something that concern should be heightened?
Well, it could be. I mean, but I don't know if they're all eating together in the same area. It might be even safe if they actually are stay in their cell and it's just them, if they don't have a cellmate or them and the cellmate. So the answer would be, I guess it just depends.
Hmm.
If they're out eating together or on the yard together, or if they're literally just in their own cell, that they actually may be somebody who is less at risk because they're just in there, them and their cellmate.
Okay.
So
So
it just depends.
I guess it kind of goes back to because they're not really exposed to, or if you're in jail, you're not exposed to maybe the outside um, effects. So
Right. I mean, yes, that's true, but we don't know who's new coming in. If you have people coming in from outside that just, get
corrections
arrested
officer,
newly.
so like
Yeah.
a correction officer could bring it in. So it is
Hmm.
okay. And another issue, a question that I've had for some of my clients, especially in a divorce, I have some cases where the parents are still living at home together, and given that we have to stay at home, that we're on lockdown, have you seen or have you heard that there's an increase in maybe domestic violence or things of that nature when people are forced to be locked in the same home?
Yes, I actually did call the physician for CHOA here in Atlanta, who's in charge of child welfare and in abuse cases. And he basically told me that they are preparing for increased child abuse and increased domestic violence, because it's the perfect, everything is the perfect risk factor. You, women and children usually are able to get out of the house to go to work or go to school, and they're stuck together 24 hours a day. There's also financial burden. And so nobody is immune. You could, rich to poor to black to white and everything in between, everybody is at risk. Nobody's immune to financial distress. Basically the world is an anxiety ball right now with everything going on, and all this is unprecedented. And schools and people losing their jobs and people furloughed and things that were unexpected. There is the perfect amount of risk factors for domestic violence and child abuse. And I called him, a week and a half ago, and at that point they were preparing. I'll probably call back and see if that is true. But he did say back in 2008, the occurrence of children with brain injury, head trauma, was increased in 2008. So they're preparing for that currently. And so the answer is yes, all the risk factors are there. So we probably and likely will see an increase of domestic violence and child abuse during this time.
Okay. How can, I mean, I know that you're a doctor and you treat people when you make sure that people are well. Do you have any advice for people who are concerned about that? How can they protect themselves?
Um, that is a difficult one. I know from the outside looking in, as somebody who knows somebody who may be a single mom or in different situations, to always call and check on them. Or if there's anything that you can do by bringing groceries or just offering a helping hand in some way or the other. Um, I guess being in those relationships, maybe try to stay in a different room. I don't know. That's a difficult one to navigate, and I'm not necessarily sure. But I know from the outside in, if you know somebody who is a single parent or someone who is within a relationship where it's a little bit aggressive, that taking the time to reach out and let them know that they are cared for and that they're heard, that is a good that is something really empathetic and tender that you can do
Okay.
within those walls. mm, I I don't know.
I know one thing that I have let clients know who have contacted me is the police are still working. They still have to go to work. They're essential. You can still go to court and file a TPO. So there are things that can still be done even while we're going through this COVID-19. So Dr. Jones, I know that you were on the front lines. You've been working. You're tired. I really appreciate you making the time to speak to my subscribers today. Do you have any advice? I mean, this COVID-19, as you mentioned, everyone is anxious, everyone is scared. Um, no one really knows when this is going to end, what's going to happen. Do you have any advice for people who are just anxious and worried about COVID-19?
My advice for that is stop watching the news and being on social media all day. Being immersed in all of that is just ridiculous for your psyche and your emotions. Choose 1 hour, whether you choose it in the morning for a news show or in the evening. They're all basically saying the same thing. Quit watching it all day. Choose one morning hour or one evening hour, watch it, and that's it. If you're on social media, maybe set an alarm where you're on it for an hour or two and then get off. Take some time for self care. There's exercises that are streaming. Make sure that when you went grocery shopping before we were shut down, that you got good healthy things that you can make soups, chicken soup, all your vegetables, colors of the rainbow, and make casseroles or whatever you need to do to eat healthy. Drink tons of water And then meditation and prayer, make sure that you're taking some time for mindfulness. And also, if you can go outside in your own neighborhood, not around other people like the Greenway or the Beltline, but if you can go outside, get some sunshine, get some fresh air, walk around, make it electronic free. Because with our cell phones and iPads and everything in our hand, all this electromagnetic frequencies, try to just ground yourself and be in Mother Nature. And also just pray for the front line. So, front line would be those that are involved in the intensive care units, the ER, and the hospitalists, and everybody involved in that. And then the way that I'm on the front line is as primary care. All my patients are calling or seeing me to basically navigate through what is the threshold or when should I go to the ER or not. So me just making sure that that 80% stays home out of the ER and preserves those resources and those people for only the 20% that truly needs it, as well as the other people. We still have gunshot wounds and motor vehicle accidents and dog bites and all types of stuff that goes to the ER. And we need to save those resources. But I just want everybody to pray for our healthcare workers because they are on the front lines. And we are still struggling with not enough PPE, which is personal protective equipment. So it's basically like sending a firefighter without their garb into a fire, like sending a soldier without a gun into a war, like sending a police officer into, a trap house without a bulletproof vest. You know what I'm saying? And so here we are, people are dying,
Mhm.
and healthcare workers will get it worse. Here's why: viral load. It is a virus, and when you are you could be healthy, but if you're exposed to the virus 10 to 15 times a day or more, that viral load that your body has to fight off, eventually your immune system can't fight it off, and those are the people who get the sickest. We're having even young physicians that are passing away. It broke my heart that I saw a couple of resident physicians in New York passed away, people with spouses and families. And I was like, whoa, we spend too much time, and we have had, it's just ridiculous. As a resident physician, you're still basically broke, making, a minimum amount of money with the goal of, I can't wait until I graduate from residency and become an attending physician and finally make a pretty good living and be able to support my family fully. So for two young resident physicians who had come this far with that much training to pass away because they weren't protected when they should have been garbed up just like you see in Italy and China, and they're going in and putting themselves at risk. And it's just not fair that they're on the front lines and have to die. And so that's what we want to prevent. But enough with that traumatic piece. On the other side, just stay calm and eat well, drink water, take your supplements, be out in nature, really love on your family, and don't just say, I'm stuck at home. You are safe at home. And just take care of yourselves, mind, body, soul. It's all the physical, the emotional, and the mental. It's all connected. So you have to cultivate, honor, be grateful, and be gracious with yourself in all realms. And that's what I would leave with.
Definitely. And I know that we are wrapping up, but you mentioned eating well, working out. Um, that actually helps build your immune system to fight the virus, correct?
Definitely, definitely.
Okay.
Sleeping. Yep, sleeping, water, nutrition, exercise, all of those definitely contribute to your immune system.
Okay. Thank you so much, Dr. Jones. We really appreciate you being here with us. And I just wrapping up, everyone. Thank you for tuning in. Thank you for watching. Again, I'm attorney Chinwe Foster with the Foster Law Firm, where we specialize in aggressive and effective legal representation. If you have any questions for me, you're welcome to contact my office to set up a consultation. That number is 404-525-3082, or you can go on our website at www.fosterlawga.com. Again, thank you so much, Dr. Jones, and
Thank
we
you for having me.
thank you. We'll talk to you soon. Bye bye.